Hi, my name's Stacey Farmer. I'm a pediatric occupational therapist. Jamaica is very laid back. She's outgoing with people she knows. She's a little on the timid side when it's people she doesn't know. She likes to just kind of hang around and do nothing. She explores. She's always on her leash because she likes to wander. She's very curious and she's very, very, very smart. Over the summer, Jamaica was limping a little bit, but it went away. So I thought maybe she twisted her foot and it went away. And then when we brought them in for their annual checkups, beginning of September, Dr. Archer immediately noticed a difference in her gait. Doc diagnosed Jamaica with a torn ACL on her right knee. I'm very thorough, so I asked him what the course of treatment would be and what her follow-up would be. So he recommended the TPLO surgery, and then it would be followed up by 8 weeks of PT and leash walking and so forth. Honestly, I thought my life was over. It was going to be intensive. She had to be crated. She had to be leash walked. I have a 4-year-old chocolate lab. Jamaica's 4 years old, so it was going to be tough trying to keep her calm and relax. For Jamaica, I think I started to notice the improvement probably a week or so. She was doing really well from the surgery. She was weight bearing the day after the surgery when I picked her up. She had limited range, but with my stretching and Dr. Archer stretching her and doing the TENS and the different things that he did, she progressed really quickly. In the beginning, she was more laid back and kind of laid around a lot. And as she progressed and as she did more with Dr. Archer, she'd be up more and she'd be walking around the house. She'd want to go out more. And her gait started to go back to where it should have been. I really liked Dr. Archer's rehabilitation team. Like I said, Jamaica's a little timid and a little standoffish sometimes, and she loved them. In the first 1 or 2 visits, I would bring her in and she'd try and drag me back out. And then after that, I would bring her in and she would make her left to go into the back room and not even look back. I did. Again, being an OT, there's differences between us. There's occupational therapists and then there's occupational therapy assistants. If I were to be injured and need therapy, I would rather have a registered occupational therapist than an assistant. And I like that Dr. Archer had all the anatomy and all the background, and he follows her case, and he knows her to follow through with her and the rehab. Jamaica was a very fast healer. Dr. Archer was very pleased with her success, and she healed very quickly. She was progressing and doing milestones before dogs typically would have. So I would say probably the 4-ish, 5-ish week, she was doing a lot more stuff. She was doing more the dancing, and I had to kind of control her more on the leash because she'd want to jump up and say hi and more of that kind of stuff, getting back to her normal greetings and not just, oh, you're home. Before her surgery, she was favoring her left leg a little, and I wasn't noticing it totally. Dr. Archer really, really noticed it. And she wasn't playing as much with my lab like she usually does. And now she's back to running, she's back to playing, she's back to beating up her brother. And with perfect timing because she's a snow dog and she loves the snow. I think it helped her a lot. I have friends that have had TPL surgery and haven't had rehab, and they tell me that at, I don't even know, week 3, they're just starting to walk a little bit of a distance. And I'm sitting there saying, oh, well, I was doing that at day 8. Because, she had strength training and she had endurance training and she had stretching and icing, and they didn't. I would definitely recommend Dr. Archer, his staff, and the clinic. Just happy that Jamaica's back to her old self, and she's enjoying the snow, and she's enjoying running around, and she's back to her normal, boisterous self.